welcome back to the Oral Health Podcast. Now, Smile Month is fast approaching, and so we've got a couple just in the run-up, just talking about our mouths. Now, this is a less cheery topic than we have done previously, just talking about what you can expect following a tooth extraction, because unfortunately, a lot of people do have to go through this at some point. So it'll be good to just have a bit of a chat about the reasons someone might need it, and what you can do before and after to prepare and take care of yourself after it's happened. So, Karen, I imagine, from the dental helpline days, this is probably quite a common thing, wasn't it?
Yeah, it can be. I mean, not all extractions are due to dental decay. Some are due to gum disease, where the tooth is exceptionally loose because the bony support has been lost. But there are also reasons when you're a bit younger, having teeth out before you have orthodontic treatment, or to create space so that the adult teeth can come through. So, there are a number of reasons that you might need to have a tooth removed. It isn't, something that anybody takes lightly, especially the dentist. I mean, it is, you do get the patients that come in and say, I want to have all my teeth out because it would be much less hassle. I mean, ethically, a dentist is not going to do that.
No.
A dentist will only take a tooth out if it's for the reasons that I said. It's reached the end of its useful life, or they need to create space for orthodontic treatments, straightening teeth. So it is always better to try and keep your own tooth if you can. There is really nothing that is going to be exactly the same as having your own tooth. And people seem to think that some people, not all, and it is getting rarer, that people want to have full dentures because they think it's less trouble. You still get trouble with dentures, so it's if you can hang on to your teeth, all the better. Now, if you are booked in to have an extraction, you are probably going to feel anxious before you go in, especially if you've never had it done before. So what I would suggest is make sure that you've had something to eat before you go in. There's nothing worse than somebody with very low blood sugar who is likely to faint. So make sure you've had something to eat, not a heavy meal, but you've had something to eat, plus the fact you're going to be numb afterwards and you don't want to eat straight away. So just have something light. Pick a time of the day where you're less likely to be so worried. So if you're not a very good morning person, don't have it first thing in the morning, and maybe have it after lunchtime, but pick a time when you are likely to feel the most relaxed. Again, take somebody with you if you need to. You might feel that you want someone to drive you home if you're driving, that you won't be having anything that legally stops you driving unless you're having a sedation. But most people don't have sedation for extractions. So if you think you will feel better if somebody else is driving, then do that. And then obviously the dentist is going to numb you up, check that you're numb all around the tooth, and then they will remove the tooth. Now, because your mouth is very near your ears, you can hear things. Now, that's not to say that you will feel anything, but it's really difficult for our body to differentiate between sound and pain. And often we hear something and we think it's going to hurt, but that's like a reflex, our flight mechanism. Yeah. So we hear a noise and we think, oh my goodness, it's going to hurt. So what you've got to try and do is relax as much as you can. And I know that's easier said than done because I'm not doing it. But I've had teeth out for orthodontic reasons. I was actually working as a dental nurse at the time because I had adult orthodontics. And I do remember the feeling of, gosh, what they're going to do, even though I'd seen hundreds of teeth being taken out. Now, there is a knack to taking teeth out. Teeth are not pulled out, despite what we say. They have to be sort of removed from the socket that they're sitting in.
So they're sitting wiggled, right?
Well, yeah, but when you almost sort of push it first because you've got to kind of release it from that socket that's holding it. So you will hear some cracks, and there will be sounds to it, but you shouldn't feel any pain. Obviously, if you do feel pain, you can raise your hand. You will have a sign that you agreed with the dentist, and then the dentist then sort of makes it as looser and looser, and it will come out. Now we're talking about really healthy teeth there, so I'm talking about orthodontic
Yes,
extractions,
yeah.
where a tooth is being very well held in because it thinks it doesn't want to go anywhere. It's going to stay there for life. Now, if we're talking about somebody that's got gum disease, for example, the tooth may need removing because it either keeps getting a gum abscess around it, so there's a lot of infection there, or it's so loose that every time you bite on it, it's painful and it just wobbles out the way. So it's not useful for biting on either. Now, those teeth are not going to be too difficult to get out, so you will be numbed up, obviously, and it will probably just take a little tweak, and that tooth will be out. And for those people that have a lot of kind of wobbly teeth, they normally find they have much more function after the teeth have gone, and they perhaps have a partial or a full denture. They will get much more chewing power back. So it's often, and they probably look a bit better because, if as your gums shrink, your tooth gets longer. I mean, as the saying goes, you get long in the tooth.
Yeah.
So again, aesthetically, it can look better when those teeth have gone. Decayed teeth do have a tendency to crumble as they're being taken out. So sometimes the dentist will warn that they're probably going to have to take them out in bits. So they'll be taken out in sections. So that is really the procedure. The dentist will then get you to bite down on like a cotton pad for about 10 minutes to try and just get the clotting process started. And then you can leave the surgery, probably with another couple of packs just in case it starts bleeding again. It will ooze for about the next 24 hours, and because obviously our mouth has a lot of saliva in it, it mixes with a little bit of blood and it looks like masses. It's not masses of blood, it's just that oozing. What I would say is when you go to bed the night of your extraction, and maybe the night after, put a towel on your pillow, because if you do dribble, there'll be a bit of blood in there and you don't want to ruin your best pillowcase. So that's very important. Also, aftercare, your dentist will give you an aftercare sheet if they don't ask for one because they might have forgotten, but you need to have an aftercare sheet. So what we want to do is keep that clot that is forming over the socket that's been left, the hole that's been left by where the tooth was. We want to keep that clot in place for as long as possible. If it comes out too soon, you are at a higher risk of getting what's called a dry socket infection, which is an infection of the socket, the hole that the tooth has come from, which can be really painful. And you will need to go back to the dentist and they'll either pack it, give you some antibiotics, or both, maybe, to try and get hold of it. So to preserve that clot, we don't want any rinsing for 24 hours. We want to keep that in place. So you can brush your teeth very gently, just very gently around that area. Don't dislodge the clot. Be careful of what you're eating or drinking, nothing too hot because you'll be numb. And try and eat on the other side. You probably will automatically want to do that. Don't take any pain medication that contains aspirin because it will make you bleed more. But if you do need to take a painkiller, you can almost take one just before you get to the dentist so that it sort of kicks in when you've had the tooth out. And just stated dose. But as I say, avoid anything with aspirin because you don't want to encourage the bleeding. Over the next couple of days, it might be a little bit sore and tender. After 24 hours, you can start rinsing with a salt mouthwash. Is normally the best, cheapest thing you can get. A tumbler of warm water with a teaspoon of salt in it. Do that as many times a day as you want to. Normally, after eating is best. And you can continue doing that probably for as long as you want, really. But I would say the next 5 to 7 days. And if all's gone to plan and it's healing nicely, you won't need to go back to the dentist. Some dentists might want to see a review, or maybe if they've had to put stitches in, because sometimes if the socket is very large and there isn't very much bleeding, the dentist might want to put a quick suture in there. So you might have to go back and have that removed, or it might be a dissolvable one. But as I say, that will all be on your aftercare sheet. And normally a week you'll be back to normal, probably before that, to be honest. And you can be back to normal. But don't let having the tooth out stop you cleaning your teeth. You still need to do that, and you can use a mouthwash afterwards. If you don't want to use salt water, you can use a normal mouthwash. But what we want to do is keep that hole that's been created clean. So we want to keep the socket in for 24 hours as much as we can, and that will start becoming part of the healing process. So the clot will start to break down and it will become part. So you don't need to take it out. You don't need to even think about it really. Just keep an eye. If you don't get any pain or discomfort and it's healing properly, brilliant.
So that's a good sign.
Absolutely,
Yeah.
absolutely. And eventually it won't be such a big hole, because the bone will start to heal upwards and sort of fill in that area. But the gum will heal over relatively quickly. So it's like having a wound anywhere in your body. You just got to keep care of it. Obviously, you can't put a plaster on there in your mouth.
Well,
but
no, it won't stick, will it?
No, no.
I remember those. They were like packing peanut size almost,
Yeah.
to bite down on, because I had to have 4 teeth taken out when I had my braces.
Yeah.
So that's why I said, like, oh, it wiggles, doesn't it? Because I can remember the like sort of feeling like it was being wiggled. You can't see what I'm doing with my hands, but
Yes.
like
Wobbling.
a seesaw kind of
Yeah.
almost.
Yeah, it's being manipulated out of. Essentially, it's sort of stuck in a. You can't see me doing it either, but there's a socket holding your roots of your tooth in, and you're having to sort of manipulate that tooth out. So you're going to be left with a tooth-shaped hole.
Yeah.
So that hole then has to heal. So yeah, I mean, I would say don't use the packs that the dentist gives you unless it is absolutely positively bleeding. It's not just the oozing that we're talking about, because if you put the pack in and bite down on it, the clot that's being formed will come out with the pack. So you will lose that clot that we've been talking about, that it's important to keep. So if you can avoid using it, do avoid using it. That's only for emergencies. If you look at it and you can see the blood keep coming out. Obviously, if it keeps doing that, call your dentist. You need to see them, because they might need to put a stitch in there to just stop everything and just get everything sort of pulled together. So I'm doing that with my hands again, so that the healing process can start. I mean, for full healing, you are talking about 6 months. So that's sort of the bone healing, but the gum will have healed much sooner than that.
Yeah.
As I say, it's in 5 to 7 days, depending on your healing capacity. So, and then it's all over and done with.
Indeed. And we have a full website about what to do following a tooth extraction that you can read and peruse at your own leisure. But like you say, the dentist should give you an aftercare.
Absolutely. Yeah. You need to have that, because it's to refer back to, because it's a lot of information to take in, and I wouldn't expect anybody to listen to me rambling on and go, oh, I know exactly what I'm doing now, because you've got to kind of like look at the stages through it. So you need to refer back to it.
Absolutely. And or if you're listening to this because you've stumbled upon it in your research preparing for an extraction, I hope this has reassured you that it is a very normal procedure and that you will be fine, and that as long as you manage your mouth health properly and listen to the dentist's or orthodontist's advice, then you're on for a winner. You'll be absolutely fine.
You'll be fine. Yeah. As I say, it's always a last resort. So if you're thinking about going to the dentist and you think you're going to need lots of teeth out, they will only remove teeth if they've completely, they're not of any use to you anymore. So don't worry unduly if you've not had a diagnosis yet.
Okay, and we'll be back next week talking about something that is not tooth extraction. So I hope that you have a good week, and we'll speak to you then.